Good evening. I'm Howard Wollaston, Executive Portfolio Holder for Public Health, Community Wellbeing, Leisure and Culture, and Chairman of this meeting. A warm welcome and particularly meant to members of the public streaming this meeting or watching later. I'll be assisted this evening by James Townsend as clerk for the meeting, by Kevin Griffin, who is a Zoom host. I will now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chair will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by a show of physical hands. If we need to adjourn the meeting for any reason, then the chair will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Don't see any hands up there, so can I ask whether you have any apologies, please?
We haven't received any this evening.
In that case, can we move on to minutes? Do any members? I don't see any hands again, so in which case I will sign these minutes electronically. Class members, do they have any declarations of interest? In that case, I will move straight on to item 4. Which is to do with the vaccination rollout. Clearly, there have been massive strides in the last few days in the number of vaccinations, but it's still the issue which is probably highest in many people's minds as a way of returning to normality. I'm therefore delighted to welcome Dr. Abid Irfan of the Strawberry Hill Medical Centre in Newbury to provide an update. Abid.
Thank you, Chairman. So thank you for inviting me this evening. As many of you will know, we've been working very hard over the last couple of weeks to get the racecourse site as a vaccination centre up and running. So it's taken a bit of time, but thank you. Huge thank you to the racecourse and the hard work put in by the practice managers and the GP colleagues who have been leading on this with support from the CCG. So we went live last week. And the first week's been a real success. So there are 9 practices working jointly together, operating the centre. So in effect, what we've done is kind of set up our own kind of mini mass vaccination centre. And the racecourse site was chosen because we've got history with it. So as some of you will recall, we ran the COVID hot hub there during the first lockdown. And that was a successful joint venture. So we went back there again because the site is a central location with lots of easy access, parking, and a great venue to work with. So a huge thank you, as I said, to all the staff and volunteers in week 1. And we've taken things a bit slowly during the first week, just to test out all the procedures and the protocols. So we've had some excellent feedback already from patients who've been through. The first week we ran the clinics using the Pfizer vaccine. So we had one delivery on Wednesday, and that was done kind of initially on Wednesday afternoon with some testers, and then all day Thursday and Friday. And then there'll be a clinic and tomorrow as well. There was a clinic on Saturday as well. So we spread that one batch kind of over a few days, as I said, just to test out what the process was. In addition to that, we had approximately 300 of the AstraZeneca Oxford vaccine, and we did 3 of the largest care homes in the patch as well. So plans going forward for week 2, we'll be running clinics probably to full capacity in the next week. So we've got Tuesday all day with one batch, so that'll be a busy day, and then Friday again, this week, running kind of to capacity as well. So and then on the weekend there's a few small numbers, and then after that, with the Oxford vaccine, we've got the housebound patients, and we'll be utilising the community support services to help with those. So I think really good start, and we're hoping to ramp up the numbers as we get more and more of the vaccine, but it is dependent on the supply of the vaccine.
Thank you, Abby. Could I just kick off, taking Chairman's priority, whatever it is? I represent Lambourne Ward, which is the far west of the district, as you probably know, and a number of my residents have friends and family who live just the other side, the 2 miles the other side of the border into Wiltshire.
Yeah.
And there they've been providing vaccinations through various surgeries, which we obviously haven't done. I'm being asked quite regularly why.
Okay, I mean, yeah, very good question. I can understand patients' concern. I think the key reason was not to disrupt services back at the base. So I know some practices have done that, but our view as a collective group of GPs was that it was best done offsite so we could maintain those services. And as you know, we've got a number of national priorities, maintaining services like doing the health checks for learning disabled, the mental health checks, smears. There was a whole host of things we were asked to do and continue to do, irrespective of any lockdowns or what the state was with respect to infection rates. So we felt to provide a safe and ongoing service for all the routine care, it was best done off-site, off the surgeries, and on all the kind of logistics around the Pfizer vaccine, the infection control, mixing up. It just made sense to us.
I've got loads of hands up. I'll start off with Councillor Doherty.
Thank you, and thank you for joining us this evening and taking time out of your busy day. And I'd echo the thanks to all of those working over at the racecourse, and especially the volunteers. I know you've got lots of volunteers over there as well, yeah. So I'd echo that thanks. I think we've probably got lots of hands up because there's lots of questions coming in from our residents. So I thought I'd start with, I actually had an email yesterday and there were two key questions on there that I thought I'd put to you, if that's all right, Abid. Yeah. And then there was one of my own that I wanted to add to that. So I had a resident email yesterday that asked how many vaccines have been administered to people in our area to date, and what percentage of the over 80s does this represent, and a conversation from the resident about how we can share that information going forward.
Yeah, I mean, I think all good questions, but at the moment we're asked not to share local figures as they are sent and compiled nationally. So, and then they need to be validated, and then they will be released to ensure that they're accurate. So at the moment I can't give you those figures because that's the rationale for that. In simple terms. Okay,
we're getting asked it an awful lot, so I think it's just probably useful to have this public forum to let people know that's actually the case. Yeah. And then the one from myself is, obviously today there's been a lot in the news about moving on to the over 70s and the clinically extremely vulnerable, and that there were letters going out inviting those to join. Do we have an indication when that will be the case here in Newbury?
So I think there is, as you know, there is the national priority list of patients. So I think because we were slightly late, one of the later waves to start because of the setup time, we need to probably continue with the over 80s, and we think by the end of in the next couple of weeks we should have all those, because we have got quite large numbers. We've got a fairly elderly population in our patch, so we will probably need to focus on those. I'm quite confident that we should get all the care homes done by this weekend, because we have the supply, and we should be able to deliver those. So I think once we've got those two cohorts out of the way, then we'll move down the cohorts, so the over 75s and the 70s and the extremely clinical vulnerable. It is all subject to kind of supply of vaccines, because at the moment you can't kind of go in and order vaccine. It's a kind of a push system, but I think that's going to, I am advised that's going to change. So I think, and the difficulty with planning at the moment is you don't really know what you're going to get the next week, so you're kind of working kind of within a short few days, and that's why it's not as smooth as it could be. But I think once we're on an ordering system, we can plan weeks in advance. Then we will have our numbers, we'll know, we can put the clinics on, and we can get patients done. But I think, I mean, the mission is to get as many of those priority groups done by kind of mid-Feb. I think that was a national guidance that we should aim for that. And I'm quite confident if we can get the vaccine supply, we've got the capacity at the racecourse, you know, we should be able to achieve certainly the high-risk groups, the first four categories.
Okay, thanks, Abid.
Moving on, Councillor Masters.
Thank you, Chairman. Thank you, Abid. I just have a couple of questions. I've had a few interactions over the last 48 hours from residents across West Berkshire, actually, saying that they've had calls to attend both the racecourse with the PCA, with your group and your vaccination programme, but also the NHS centre in Marlow, and they're a little bit confused. What's the advice? Should they go to one or the other, or should they interact and confirm with yourselves at the racecourse and their specific practice?
Yeah, I mean, I think that has caused a bit of confusion, but I think that it was there to provide some choice. So my advice would be, look, if patients want to go to the mass vaccination centre and they're able to get there and they would like to do that, then that's absolutely fine. They can book. Alternatively, if they don't and they want to be vaccinated locally, we will get in touch. So it just depends, you know, if it's the over 80s, we are working through the lists. It's going to take a bit of time because it's quite labour intensive. I think so. If they would like to be done locally, they can get in touch with the practice. But ideally, we are, rather than clogging up the lines, we are working really hard to contact all those patients, or certainly the over 80 group, so they can hold on. We will be in touch, and then they can have it done locally. So it's really a matter of choice for the patients if they want to.
Okay, but thank you. Just before I come on to my second and final question, just to clarify something, how is the data recording coordinated between? So say if they do go to Marlow, will you be in touch if they don't attend and stuff like that? Just so that there's no wastage, so you can then allocate the vaccine to somebody further down the list, for example.
Yeah, so we're using there's a national system. So as soon as you have the vaccine, the idea is that it's recorded live, and that information is automatically sent to the GP computer system and downloaded into records. So it will be recorded that you've had the vaccine. Also, you can do a search, and there's a national kind of immunization service where the data is there. So if I log onto the system, I can see actually if someone's already had a flu vaccination and what date it was. That information is there because you're not supposed to have one within a week of each other. So ideally, if all the information is flowing, which it is, because I've certainly seen it dropping into some of my records as I've been working today, it is working. You should be, and when you do your call and recall, you should know. Technically, you should know who's had it and who's been coded, and they will, so they won't be included in your call lists. And I think that system will probably get smoother as time goes on. So, yeah, we will know if you've had.
Okay. As you ramp up the volume, do you expect to go 7 days a week, or at least 5 or 6 days a week? Does the racing on a Wednesday impact?
Yeah, I mean, it's subject to kind of race days. So that's the first point. So if there's a race day, even if it's behind closed doors, then I understand the race course has said, we can't be on site. So it is subject to that. But assuming there's no race days, then the next question is, when are the supplies coming in? Because let's say if the supply lands on a Monday, you usually book the Tuesday, Wednesday, kind of, and Thursday, so the next kind of 3 days. If you were getting supplies in every day, and you're not worried, you've got the dates and you've ordered them, then technically no racing, and you could operate that as a 7-day hub, absolutely, subject to staff and volunteers and everyone doing it. Yeah, there's no reason why not.
Okay, thank you very much, Doctor. Thank you.
Could I move on to Councillor Bridgman?
Thank you, Chairman. Abid, a couple of questions. Following on from that last point, is there any difference in the process for engaging your patients if it's the Pfizer vaccine or the Oxford vaccine? So is that, in terms of your storage processes and delivery processes, does that make any difference to who you call and the timescale over which you call them?
Not really. I mean, the difference is, as you said, just with respect to the kind of the behind the scene logistics. So actually, if we were getting larger supplies of the Oxford vaccine, you could probably ramp up capacity a bit more, because I think you could probably do it in shorter time slots. We've been a bit cautious initially. We've kind of allocated 5-minute slots, but I think as the cohorts get as you move down the cohorts and people are fitter and young and more mobile, you could probably significantly increase capacity, and you don't have to mix it up as well. The AstraZeneca one, you don't have to reconstitute it, so you just draw the injection and give. But with respect to the patient, there's no kind of the contraindications are similar. They shouldn't notice any difference, basically.
And my other question was whether you're seeing any, and this was a question I got asked at a parish council meeting from someone whose girlfriend is on the list to become a vaccinator. So this was coming out of the system, and I didn't understand it, whether you're seeing any kind of significant level of no-shows.
Not that I'm aware of, no. So from the feedback I had from the team who've been kind of vaccinating last week and week one, there was very few no-shows from what I'm told.
Thank you, and thank you to you, and thank you to can you pass our thanks on to the rest of the team?
Yeah.
Thanks, Chairman.
Councillor Vickers.
Thank you for that, Dr. Irfan. Yeah, one of my questions is going to be about the level of wastage, which obviously would be related to people not turning up, and whether you're able to if people refuse, say DNA at the last minute or say they can't come, whether you have a quick way of quickly bringing in somebody else, because the vaccine doesn't last very long, does it? And it would be a shame if it was wasted. And then sort of attached to that was a little bit about the level of refusal. Have you got statistics about the number of people who are refusing to have the vaccine? And then I had another issue about, are people given their appointment for their second vaccine when they come for their first? And also, how are people being told? Do we get a letter, or is it a phone call or a text, or can it be either?
Yeah, okay, thank you. Yeah. To prevent wastage, the way we're working is we've got lists of patients, and those lists are taken to the hub site. So let's say, for example, you were planning on delivering 100 vaccines in one particular pod, one line, and say 10 didn't turn up. You would have a reserve list, and you would work down the reserve list and see if those patients could come down quickly. Initially, there's been no wastage because we've had all the staff who are vaccinating at the hub. They need to be protected. The care home staff, those perhaps who didn't go to Wokingham or missed out in the first initial tranche, we weren't there on the day. So there was been plenty of people you could quickly call, get down, and say, come down straight away. That's what all the sites have been doing, and vaccinate them. As to kind of, so that's prevented any, and hopefully that will continue, because going forward, as you go down the cohorts, you would do the same mechanism, and probably even quicker with text messages come down now and so forth. So refusal, I don't think there's been many. There will probably be data on declines, but I haven't got that. And I suspect, again, that's probably the same answer earlier. It'll be collected nationally, and I suspect that will be shared at a national or regional level as to how many declines there have been. So we won't know that. But just anecdotally, certainly from talking to the social prescriber and admin teams who've been ringing in my practice, I can tell you that they're on the list I saw last week, there was, out of 200 people, I think there was one decline, just as a kind of all the people that were the clinics that were booked up, yeah. So that was just anecdotal. I mean, that's not statistical or anything, but that's what we saw. Second vaccine, initially we were booking in for this appointment for the second vaccine, but we've actually has made a decision to stop that at the moment because we weren't quite sure of race days going ahead. So what we don't want to do is like have lots of clinics booked up and then suddenly be told. So we just need a bit of just internally, we just need to work that out. But what we're saying is, don't worry about that. We will sort it once we've got the dates pinned down. And we will either text or, I mean, obviously for the over 80s, we will call and write. So people are getting the call booked in, and they're getting a first class letter to confirm the appointment as well. And if you need to make any last minute changes, we've been just calling them because we had to shift one of the clinics around, and I was helping out calling patients, and they were very, they were very pleased that we called, and they're very make a last minute change. They were just glad to get the vaccine, really.
I bet.
Yeah.
Thank you very much indeed. Thank you.
Finally, Councillor Berg.
Thank you, Chairman, and thank you, Doctor. Just an observation, first of all. I yesterday received a message from my surgery via the My GP app, and they told me quite clearly that to expect an invitation to attend a mass vaccination hub, which may be further afield, but that if I didn't want to choose that, I could wait, and then I would be invited to Newry Racecourse. So very clear communication from my surgery. Doctor, I have a couple of parishes in my ward which in which many of the residents attend surgeries across the border in Hampshire. There's a perception that Hampshire seems to be running at a bit of a different pace from surgeries here in West Berkshire, and there's a concern that residents have concerns that they're not getting a fair deal in terms of when they receive their vaccination. And what can I tell them?
So I think, so as in Hampshire ahead of the game, is that what's being said? Yeah. Okay. So I think as I explained earlier, we were one of the latter waves. So it's just a question of timing. We will catch up, and as supplies increase to our hub, we can ramp up capacity significantly. So I think there may be a bit of a lag, but I would reassure patients and say, look, we are working on it. We're, a lot of effort's going in. The hard work's done now, so we just got to get the vaccine in, and then we can ramp up capacity. So not to worry. we will get through all the cohorts, the priority cohorts. You know, we may be 2-3 weeks behind people who started right before Christmas, but we will get there. People will get their vaccination.
Thank you. That's what I'll tell them.
Yes, Doherty.
Yes, something I forgot to ask earlier, sorry. Obviously, as a council, we've been looking after the clinically extremely vulnerable. In your presentation, you mentioned that you were going out to housebound. Can you just give us a definition of how who you think of as housebound, how they're being decided that they're housebound, just so people watching are clear that there is I understand there is a difference, so I just think it'd be worthwhile just going through what housebound means.
Thanks, Councillor Doherty. Well, I think when I say housebound, I'm talking about those really frail elderly patients, absolutely kind of don't go out at all for whatever reason. And they have usually been coded on a GP practice system by their doctor or nurse or someone, with the in discussion with the families or carers, and they don't go out for anything. And they are I mean, there's a small cohort. I think we've got, just for example, a large practice like mine. I think we've got about 50 patients who are coded. And to be honest with you, we know most of those because the district nurses are usually involved with them, and they might go in to give their flu. But if you're clinically extremely vulnerable, it doesn't mean you're housebound. That's not housebound. So when we get down to those cohorts, we would expect, if you're mobile and you can get out, and you were technically categorised in that category, we would expect if you want to get to the racecourse, to the hub, to get your vaccine. Unless there's another reason, there's absolutely you can't get out. But I think there'd be very, very, very few cases of those.
I can't see any other hands. So Abby, can I thank you very much for taking time your, I know, very busy schedule to join us. It's been very helpful. I'm sure it's relieved an awful lot of the people who might be looking at this from the public. So thank you so much.
Yeah, thank you. Thank you.
Can I move on to Matt to talk about the situation report and incidents?
Thank you, Chair, and evening, everybody. So just going to take us through the slides today around the surveillance and the latest epidemiology. As always, just to remind us in terms of where we are, clearly we're still in the third national lockdown, so really important for the public to continue to comply with national guidance. So only leave will be outside their home for very limited purposes, such as shopping for basic necessities, exercise, go to work, if you cannot go from home, or to escape risk of harm. So really important that Berkshire residents still can play their part throughout this pandemic. So in terms of the current cases and the number of cases, as again, we're quite familiar with this slide now. So we have the local authorities on the left-hand side. I've highlighted West Berkshire in yellow just to make that clear. And then we've got the first column on the number of individuals that tested. So we've actually seen a rise in the number of individuals seeking a test compared to the last 7 days, which is really good. We continue to advocate and encourage people to seek a test when they can, particularly if they're symptomatic. In terms of the positivity rate, so you'll recall this is a proportion of those people that are tested that test positive. So in West Berkshire, we're 1 in 10 now, about 10% of those that seek a test are testing positive. And this gives us an idea in terms of whether actually COVID is higher in the population or whether it's just down to testing. So that has actually reduced, which is good compared to the last 7 days. And that's also lower than the regional national average, which is around 15%. In terms of the cases per 100,000 population for all ages, that currently stands at 313 for West Berkshire. Again, that's a drop compared to the last 7 days. Obviously, this isn't the most recent data. I understand the latest data that was announced today was 329 per 100,000. Just important caveat to this data. So this was from yesterday's data. And whilst that's high, it's obviously significantly lower than the neighbouring local authorities across Berkshire and significantly lower than South East and England average. And then the cases per 100,000 for the population for those aged 60 or more. Again, we have quite a lower rate per 100,000 compared to our neighbouring local authorities, but also the regional national average, which is around 226 per 100,000. So yes, we do always compare relatively well to neighbouring local authorities and regional national average, but I just want to emphasise the point, we are still seeing significant numbers of people confirmed with COVID-19. And just to illustrate that, over the last 7 days, just shy of 500 people have confirmed COVID-19. So again, this just illustrates really West Berkshire amongst the neighbouring local authorities. We have Wiltshire to the left, obviously Oxfordshire to the north, and Reading and out to the east. You can see the lot darker patches, which just illustrates that to the east of the district, the case per 100,000 is a lot higher than West Berkshire. So again, this just shows the rates per 100,000 for each of the local authorities. West Berkshire to the left-hand side. I think you can quite clearly see here how West Berkshire differs to a lot of the other 6 local authorities in terms of the blue line representing West Berkshire is significantly lower than, again, the regional, which is the southeast orange bar, and the grey bar, which is the England average. So quite a big difference there. But when you look at the other local authorities, they're broadly in line with both the national and regional average, apart from Slough, which is significantly higher than both the regional and national average. And I just wanted to zoom in actually just to show the epi curve in detail, because I think there are signs of improvements, particularly across the southeast. We now know that all local authorities have seen a reduction in their case per 100,000 over the last 7 days, which is really good. And you can see that on the epi curve on the West Berkshire. So ignoring the last few days, we can see a clear downward trend. I think it was actually up slightly from yesterday, but that's normally a delay in the counting. So it's really good news, a long way to go, but we're certainly heading in the right direction. And we believe Tier 4 is making a big difference onto current transmission levels. And again, I always add just the heat map in terms of the age-specific case rates. Slight differentiation in terms of what I referred to earlier in terms of the 65s plus. So that is slightly lower than what I referred to in the earlier slide, and that's because it's slightly different age range. So I talked about 60 plus in the earlier slide, and this is 65 plus. But as you can see, you've got the age ranges on the left-hand side here, the dates across the bottom, and we can see the rates per 100,000 generally dropping now across each of those age groups across the life course. In terms of deaths, sadly, we've seen 10 deaths from the latest data we've had, which is between the 26th and the 1st of January. And our all-cause mortality rate is still 20% higher, and that's throughout the duration of the pandemic. Again, just to talk you through this graph, because I think it is important that people understand what it's saying. We have the rate per 100,000 on the left-hand side in terms of number of deaths. Obviously, the dates at the bottom. And the orange bars are the non-COVID deaths, and the blue bars are those that had COVID confirmed within 28 days. And this thin grey line you can just about see is the 5 years average of deaths between 2015 and 2019. So as you can see, with the first wave, we were higher than that 5-year average. And this part of the pandemic, we're not statistically higher than the 5-year average. I think we're obviously hearing the hospitals are very busy at this moment in time, and it's likely we will continue to see a rise in COVID deaths over the next few weeks. Whether or not we go above this 5-year average, we will have to wait to see, but clearly deaths are delayed following the number of cases. So in terms of the hospital activity, unfortunately, this is a little bit dated, so apologies for this. I think the key message, and I'm sure you've heard Matt Hancock talking in the news today, they are under a lot of pressure in the hospitals, particularly in terms of their bed capacity, critical care capacity. We might not be seeing as many deaths at this moment in time, and that's mainly because treatments are more improved. That's not to say, hospitals are less busy. We're still seeing people being treated and being cared for, but we know treatments are much better. I will stop there because I can see Councillor Doherty's hand up.
I didn't mean to stop your flow, Matt. Sorry. Have you got? I don't mind finishing if you want to finish.
Oh, okay. I can carry on. Sorry. In terms of West Berkshire, obviously we have got the dates down to the ward level. I won't go into this in too much detail because there's a lot of information on here. We obviously look here, the case and weekly rates per 100,000 between the 1st and 7th of January. And then we have the total cases and total rates since the pandemic started in March. I think there are some signs potentially when you look at the borders of Reading, so Tarhurst, Birch Copse, Tarhurst South and Hollybrook. Burford and Mortimer, again, we're probably seeing some slight increases in compared to other wards across the district. And when you actually have a look at the map, and it does show the darker patches of where the rate per 100,000 is a little bit higher, is towards the kind of the edges of the district to the east. But again, we're seeing, you know, some slightly higher rates around the Newbury and Thatcham area. In terms of the outbreaks, again, the picture of the outbreaks has changed quite dramatically over the last few weeks, so I won't go into too much detail. In terms of the schools, people might be quite surprised that's 6. Actually, a lot of that is focusing on some of the early years. We have seen a slight increase in early years outbreaks over the last week or two. I must emphasise a lot of that is staff. But clearly they're open at this moment in time, so they're likely to be exposed to COVID compared to other settings. Care homes, we continue to see some outbreaks. Hopefully the vaccinations over time will start to see an impact, but we won't see that for some weeks to come. I'm also seeing some outbreaks in supported living settings as well. So in summary, as said, positively, we're seeing COVID rates decrease across all local authorities across Berkshire. So it's really good news. Hopefully that downward trend can continue, but we've certainly got a long way to go. We've had just shy of 5,000 confirmed cases of COVID-19 so far, 500 within the last 7 days. And our rate is 313 per 100,000, which is lower than the regional and national average. And then sadly, as I said earlier, we've seen 10 deaths with the most recent data we've had between the 26th and 1st of January. So as always, I'd encourage everyone to check out the berkshirepublichealth.co.uk website with all the latest information and data, and also tips and advice and guidance to help people follow national guidelines. Thank you.
Got Councillor Doherty.
Thanks, Matt. Sorry, I didn't mean to interrupt your flow, but obviously I was reflecting on those initial slides and there was a couple of things in my mind. So obviously it appears here in West Berkshire that the current restrictions that people are finding themselves living with appear to be doing their job. However, I remember back on the 2nd of December when our cases were 52 per 100,000 and we thought 100 and 150 was high. So I just wondered if there was any key messages that you wanted to give the public with regards to hearing information that says we're lower than the southeast and we're lower than the Berkshires and we're lower than England, about the measures that we're currently working with and how we still need to work with them. If there was any key messages, I know you and I often have this conversation about timing and everything else, so I just wondered if it was worthwhile you saying your thoughts on the numbers and what people should be doing at this point.
Yeah, I mean, as I was actually saying through the presentation, it did feel a bit like Groundhog Day because, you know, this is probably the 3rd time now that, you know, I've been in this position where we're seeing a positive trend in the data. And there is that sense of optimism that we are heading in the right direction. I think it's just really important that because we know that the vaccination is now being deployed at pace, which we just recently heard, there is that I guess that belief that we can kind of let our defences down, if you like, and go back to living how we want to be. And we will get there at that point. And I guess we just need to keep doing what we're doing. Clearly what we're doing now is making a big difference. There's always going to be outbreaks and cases, and there probably will be for some time to come, possibly throughout 2021. So we just need to always keep our guard up, wherever that might be, at home, at work. There's a lot of government guidance coming out, just thinking and walking around as if you do have the virus, and that's how we need to act. And I think that's really important. We do have different variants coming through across the world at this moment in time, and we just simply don't know what that impact will have. And that was likely the reason, as we now know, in December, when our rates were so good and increased so dramatically, and we now know that was because of the new variant. So I just think we need to be constantly on our guard, keep doing what we're doing. There is light at the end of the tunnel, and I'd just like to thank everybody for what they're doing.
Thanks, Matt.
Councillor Vickers.
Thank you for that, Matt. Yes, a couple of questions. One was about compliance. I think, particularly in my area, I mean, when I go out, it seems to me that people are very compliant and I'm very aware of everybody else. But I just wonder whether you're getting any feedback, particularly from the police, about any lack of compliance. And we have had some concerns put forward about young people congregating. Obviously, it's difficult for them. And I wonder whether there's any Any feedback there, or any support or any involvement of any youth services in trying to talk to our young people, just to sort of get a message across? I'm sure it's a very small group. My other question was about when people have had the vaccine, are we sure about the issue about whether they can still pass on COVID? Because I would imagine once people have had the vaccine, they think, great, now I'm back to normal. And is there a danger that people can still pass on the vaccine if they relax their guard and don't carry on with the restrictions?
Okay, thanks, Councillor Vickers. So I think the first question around compliance, that's a difficult one. So I think I had some correspondence with Thames Valley Police about a week ago. They're not receiving huge amounts of calls, and they're not observing any major flouting of compliance, as far as I can see. I mean, I think it comes in two different ways in terms of compliance. I think there's unintentional and intentional. So there's people that clearly go out intending to break the guidance. I think, like you say, those are few and far between. And obviously, we encourage people to report that as and when required. But then there's people unintentionally in terms of whether workplace settings, because the guidance is so, there's a lot of guidance out there, and I think it can get lost in terms of what people should and shouldn't do. And I sympathise to them in that position. So, and our enforcement team with the Public Protection Partnership, I think they act on any intelligence they get in terms of this and any compliance issues, particularly in settings that they need to go to. So I'm not hearing about a great deal. That's not to say it's not happening. Again, it's just about everyone playing their part and looking out for each other. In terms of vaccine transmission, that's an interesting one. I think there's an assumption that the vaccine will likely provide some level of protection around transmissibility, but we simply don't have that evidence to date. So in terms of how the vaccine is being deployed, that is that assumption it will provide some protection, but we really don't have that information. So I think you made a really good point that actually, I think people have to assume it doesn't at this moment in time, and again, act as if, they could still infect other people. And we also have to remember that it takes 2 to 3 weeks potentially for the vaccine to make any difference in terms of somebody's immunity level as well. So as soon as you have the vaccine, you have to continue with all those same precautions. You still have to wear personal protective equipment if you're in those certain roles to do. So at the moment, yeah, we still have to carry on as we like to, as difficult as that sounds. Unfortunately, until we get all the evidence and data through that tells us otherwise, that's how we have to act.
Thank you very much. Thank you.
Councillor Masters.
Thank you, Chairman. I don't know if Matt will be able to specifically answer this. With a view to the delay in, the lag between cases and hospitalisation, and then subsequently the number of deaths. I don't know if anybody else present has got the data, but across Berkshire, has there been an increase in mortuary capacity as a direct result of the increased, numbers of deaths and what have you?
So you're saying, are we using more mortuary capacity up, or are we planning for creating capacity?
Well, are we within the limits of what we've got, or are we planning?
Okay, I see Meredin's hand, physical and virtual's gone up, so good to.
And I can help answer that one. We don't need additional mortuary capacity because actually, from that last chart, there is no excess deaths in West Berkshire, and there's minimal excess deaths across the whole of Berkshire, which was very different in the first wave. We don't need extra mortuary capacity. And I was going to make a point about the vaccine and whether you can still get the virus. The vaccine is designed to fight the virus. It won't stop you getting it, so you can still pass it on. And so that's why it's important that even though you've been vaccinated, people need to continue with all the same measures.
Meredin, I can't see any more hands up, so perhaps we can move on to Mandip and a communications update.
Sure. So just an update from the last public meeting, which is at the beginning of January, obviously when we went through a couple of changes of what we were communicating out. This time around, it's very much focused on the national restrictions, which everyone obviously knows about. But on top of that, we are doing some more work about local contact tracing. There seems to be some issues with people not providing workplace details. And so that's something that we're just trying to work on at the moment, trying to get some messaging out about that. We also are working with the Public Protection Partnership to develop some comms for businesses, just kind of reminding them of their responsibilities. to ensure that staff are self-isolating, and also just to remind them of the £500 test and trace support payment. And we're also looking to put together some case studies that businesses are finding are kind of common issues that are coming up, and just so that we can build up some comms related around that as well. We have done some paid for social media adverts aimed at 16 to 29-year-olds. And that's had some good interaction. We've had over just under 24,000 people reached within that age category. 46% of that has been for men, and 54% is aimed at women who have seen that advert, which is really, really good. We are also looking at doing some support on the vaccinations information, and we're trying to get some information together so that we've got a page on our website that has an update on vaccinations that are happening, just so that residents are kept up to date on what's going on. We've also put together some self-isolation packs, which have been created to send to those who've been tested positive, and within the pack contains information on what they have to do to self-isolate, some financial and practical support, information about mental health, and how to keep a balanced lifestyle while they are self-isolating. So at the moment, it's just in the final stages, and then we will upload that onto our website for people to have access to. But I think it will also be sent out to those that we contact via the local contact tracing process, so they have access to that as well. And along the same lines of mental health and well-being, it's obviously a bit of a concern during this time. And so we are continuing to signpost people to additional information on that. Including today, we did a Blue Monday takeover on our socials, and Paul from Public Health was the face of that, which was really good, just to kind of explain to people about obviously like what Blue Monday is, and signpost them to information about mental health and well-being. And then we just continue with all of our additional information. So what's happening with national lockdown, information about business grants, the winter grant. We're also going to put together some of the videos that the doctors have done. They've been going up on our website and on the socials as well. And just continue sharing information from the government as and when we get it. So that's all of the comms update.
And if I can see Councillor Vickers.
Thank you very much. Thank you, Mandip. I'm just wondering, following on from our being told that people are can still infect others once they've had the vaccine. Mm-hmm. Is there any plans to get that information out? Is that included in any postings that you're doing, or is that an issue that we should make an effort to try and publicise?
Yeah, it's something that I have noted, because I know that it has come up before. So okay. Yeah, we'll do some comms around that as well.
Thank you.
No worries.
Can't see any other hands up. So we then move on to items of the next agenda. If anybody's got any ideas, I quite like the idea of having someone coming in every 2 weeks to give a different view. Perhaps we can just liaise with James if you've got any ideas. That brings us on to any other business. Okay, I don't see any hands up. Therefore, I think that concludes all the business. I wish you all a pleasant evening and close the meeting.